like to call to order the Monday, June 1st meeting of the St. Lawrence County Board of Legislators. I would entertain a motion to suspend the rules to allow for the attendance of the legislators by means of, or by telephonic means. Anybody offer by Mr. Akers, second by Ms. Terminelli. Discussion? All in favor?
Aye.
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 Any opposed? Carried. Roll call, please.
Reagan,
For the attendance of the legislators by means of,
Reagan. Here he is.
Here.
Forsythe. Lightfoot,
here.
Sheridan,
Here.
Denisha,
Here.
Perkins,
Here.
Akers,
Here.
Fay. Dan's here. Haggard. Haggard,
Here.
Burke,
Here.
Arquette,
Here.
Terminelli,
Here.
Curran,
Here.
12 present.
Thank you. We will now go to the prayer by Mr. Denisha, and we'll follow it with the Pledge of Allegiance.
Thank you, Mr. Chairman. Dear God, we are needy of you. We're aware more than ever of our own weaknesses and of the struggle with dark forces that try hard to divide us and gain more ground. We ask that you would help us set aside our differences. We ask that you would help us to truly live a life of compassion, generosity, love, and respect. Respect not only for one another, but ourselves as well. We thank you that you are always with us and give us great purpose and everlasting hope. Scripture tells us, Ephesians 4:32, be kind and compassionate to one another, forgiving each other, just as in Christ God forgave you. In Jesus' name, amen.
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 I pledge allegiance to the flag of the United States of America, and to the republic
Public
For which it stands,
stands
one nation,
under God,
God,
indivisible, with liberty and justice for all. I'd entertain a motion to approve the agenda
so move.
by Ms. Terminelli, seconded by Mr. Perkins. Any discussion? Seeing none, all in favor?
Aye.
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 Opposed? Carried. I would entertain a motion to approve the minutes of the May 4th Board of Legislators meeting
So
by Ms. Curran and seconded by
Sheridan.
Mr. Sheridan. Any discussion? Seeing none, Mr. Denisha? Oh, okay, I'm sorry. All in favor?
Aye.
Aye.
Opposed? Carried. Tony, did you want to be recognized? Okay, you're just waving at me.
I was voting yes.
All right, thank you. At this point, we're going to hear from Assemblyman Mark Smollett. He's going to give us an update on the exciting things that are going on in Albany. Assemblyman Smollett, please go ahead.
Thank you, Chairman. I appreciate it. Can everyone hear me okay?
Yes.
Yes.
I think we've become accustomed to operating in the Zoom world. It's great to see everyone, and I just wanted to give the board a quick update on our legislative work that we did in Albany last week. We were in session Wednesday, Thursday into Friday morning. We had committee meetings on Tuesday, and a lot of it was COVID-19 related legislation, some of which I thought was important enough that has a local impact or a future local impact once it gets signed by the governor. So a couple of the things that were out there are very sensible things that make adjustments to help municipalities, whether it's at the town or at the county level. One big one I thought was to allow the local governments to defer payments and allow installment payments of real property taxes at local option. I'm not sure how many of these bills have filtered down. That one hasn't been signed by the governor yet, but I anticipate that it will be. Another important one is that the local IDAs can do a state disaster emergency loan program. It provides those IDAs flexibility. It can support small businesses and nonprofits. It's a gap, I think, that's out there in the current federal and state programs, and it allows local jurisdictions to pick that up if they choose to do so. A third common sense one I thought was the authorization for local governments to extend building permit expiration dates for up to 120 days because of the crisis. And another was to allow local governments to renew bond anticipation notes issued from 2015 through 2021 for 7 more years. One that has gone to the governor and it has been signed, you may have seen it on the news, was the establishing a COVID-19 presumption for public employees' death benefits if someone contracted COVID-19 after March 1st, that they would and died of COVID-19, that they would presume that they would be eligible for public employee death benefits. Another one that'll affect another bill that'll affect our local fire departments, authorizing adjustments to length of service programs for volunteer firefighters and ambulance workers. It would be a real shame if a lot of our local volunteers didn't get credit for this year because they weren't allowed to respond to calls because of COVID. They weren't allowed to do training. So it assumes that they get 5 credits per month for this year. Another important one that's going to affect our elections going forward until this crisis is over is that electronic applications for absentee ballots through December 31st, 2020 has been authorized. That's something you've probably heard from some of the governor's briefings, and it also allows that absentee ballots be postmarked no later than election day. It recognizes that there are more options for qualified voters to request an absentee ballot in light of the pandemic. The last bill that I'll brief you on is we've passed in the Assembly a moratorium on terminating utility services during the COVID-19 pandemic. There was a lot of talk and debate on that one about what is the best way to help people in need. But along with the Emergency Rent Relief Act of 2020, which is proposed to take $100 million of CARES Act money and help people that need rent relief, the utility services preventing termination was also thought to be a way to help people that are in need. There are a lot of other bills. We did about 40 bills over the course of 2 days, but I won't brief you on those. These are the ones that have a local impact. I'd be happy to take questions on them. One I do need to mention is that district superintendents, if they're not going to make the 180-day requirement, they're still going to be eligible for the for school aid. If you have any school districts in the area that haven't met that requirement, I anticipate that one will be signed by the governor as well. But all of these bills, big flurry of activity. We were due to end up finishing our legislative session on June 2nd. I don't think that's to be the case. I think there are still some local bills that we need to go back and do it, but it won't be for a while because of the primary election that's coming up. There's a lot of a lot of people that are running in primaries across the state, sort of thing. So without further ado, I'd be happy to take any questions or anything that I can help St. Lawrence County with for my position as the 118th Assembly District. Thank you.
Is there anyone that has any questions or comments to or about what Mr. Smullen just delivered? Mr. Denisha?
Thank you, Mr. Chairman. Yes, Assemblyman Smullen, this is Larry Denisha. Just wondering if there's been any discussion regarding the Medicaid cap for the counties.
There is not. It didn't come up at all in this brief 2 days of legislating that we had. As you know, when we passed the budget in the late March, early April timeframe, the division of the budget was given the authority to make adjustments based on reduced tax receipts, sales tax, and income tax. Our next review period is at the end of June 30th, and that's when I anticipate that there'll be a very robust discussion on what's happening with Medicaid, with expenses, and how we're going to find the revenues to be able to do that. So, no in this session, but yes, it's coming without a doubt. You know what the impacts have been on sales tax in St. Lawrence County. That's statewide. We haven't got the final results. Obviously, state taxes are not due along with federal taxes until July 15th. So a lot of people haven't filed, but I anticipate we started with a $6 billion budget gap in the budget itself, which projections have indicated is anywhere up to $10 billion. So without a doubt, there are going to be some adjustments there.
Thank you. Mr. Akers?
Thank you.
I'm sorry. Mr. Akers?
Yes, welcome, Assemblyman Smullen. On the installment of taxes, is that reference to property taxes or actually state income taxes?
That's real property taxes.
Okay.
St. Lawrence County would have the option to defer or install those for people that were in hardship cases. It's Senate Bill 8138 Bravo. If you like, I can send you that bill language.
Yes, I would. But in our case here, the taxes are due in January. Probably, I'm guessing, probably 70 to 80% have already paid their taxes, and then the rest would be on installment taxes. So would this be for 2021, or because everyone else that hasn't paid their full amount would be on an installment system now?
That was one of the things we pointed out in the debate over this bill is timing, and many people felt that as a matter of it being less than stellar written, that we ought to go ahead and vote against the bill. But no, you're correct. Many people have paid. The question is how is it going to affect people going forward? Those are in many cases who haven't paid or can't pay. And that was the thought, was to be able to give local governments the option to defer and knowing the people best to go on to some sort of installment as opposed to going into some sort of tax jeopardy.
Okay, this board brought that up at near the end of March, and the April payment was due. And actually, Legislator Terminelli pointed out it had only actually been, I think, 7 working days that this COVID-19, where the pause had been created. So there could be a possibility to give, the county could give for the second installment, give that some type of consideration. So I guess we'll be waiting to hear on the bill and what the terms would be, and if interest would still be applicable, all those things. But that is something that this board, I think it was Rita Curran and Nancy Arquette, had brought up. And like I said, Mrs. Terminelli pointed out it had only been 7 days as far as the April payment, and that we would give the second installment some consideration. So that will be helpful if we have some guidance from you at the state level. Thank you.
I will send you the bill, sir. And that's why I brought up these bills that will have, future local impact. They weren't the big ticket items in this legislative session, but I felt that they're very important, especially for all the counties. I represent 5 counties, and it's kind of breaking news. Some of them haven't been signed yet by the governor, but when they're sent over, I anticipate them being signed.
Okay, well, thank you again.
Anyone else? Seeing none, Bob, thank you very much. I'm sure that everybody will benefit from hearing and be very happy to hear that you're hard at work down in Albany for us. So thank you very much. Good seeing you.
Thank you, Chairman. I appreciate it. Good to see everyone in St. Lawrence County. Take care.
Have a good day.
Next, we will have Dr. Williams, followed by Dr. McGuire. Dr. Williams.
Good evening, everyone. So I was going to go ahead and give an overview of where the county stands as far as the COVID-19 pandemic. So as of today, we have 205 cases. That represents only 11 new cases since May 18th, when I last spoke with some of you. A number of the new cases are being found in the preoperative screening programs that are being done. We've done quite a bit more testing. So we've done nearly 10,000 tests in the county. The current count is 9,629. So it's a pretty significant increase. In the surrounding contiguous counties, there's only an additional 25 cases since May 18th. The proportion of patients that have been tested is a little bit over 9% in the county. And the percentage of people who've been tested who are positive is 2.2%, which is actually a decrease in the percentage, probably related to the increase in testing that we're doing, especially of lower risk individuals. So far, there are no cases of the childhood inflammatory syndrome due to COVID-19. So that's an area of concern, and we're fortunate that we have not identified any cases in the community. And we still only have 34 patients of the 205 patients who've required hospitalization. So it's approximately 17% of people requiring hospitalization. As far as testing, which is a hot topic, we continue to primarily do PCR testing, which looks for the acute infection. We are still doing some serologic testing, but mostly for epidemiologic purposes. Again, that just demonstrates that you've previously had the infection. It doesn't tell whether you're immune for certain or not. For the majority of people, the specimens are collected locally, and then they're sent off to the reference lab. It's still taking about 48 hours for turnaround to get those results back. We do have an exciting new development. However, the Lawrence Health System and shortly Claxton Hepburn have the ability to do in-house testing now. So if a patient is especially ill and is in the emergency department, we can do a rapid test that returns within approximately 1 hour. Again, that's not for the general screening, but it does enable us to take care of acutely ill patients in a more effective way. As far as who to test, the New York State Department of Health continues to expand the recommendations. Right now, there are 9 groups or priority levels. There's still, obviously people who are acutely ill are getting tested, as well as those who have been exposed and are in quarantine. But now there's more targeted screening of higher risk populations of asymptomatic people. The state has also mandated 4 specific groups of people to be tested right now, and this I'm sure will expand, but as you may have heard, nursing home employees, adult home and enriched housing employees and staff need to be tested, and they actually need to be tested twice per week, which has been a real logistical and financial challenge for them. There's now testing being done of patients prior to elective surgeries, as well as mothers and their identified partners who are being hospitalized for delivery. And then most recently, barbers and hairdressers are required to be tested and to have repeat testing within 14 days or at a 14-day interval. So there's more and more people who are being mandated to be tested even though they're asymptomatic, and that's to help identify them so they don't communicate the illness. There is still some voluntary employee testing happening. St. Lawrence Health System tested their staff, and my community health center also went ahead and tested our staff. and our employees at the group homes. As far as where to test, we still are relying on the testing centers. There's 4 testing centers through St. Lawrence Health System, 2 testing centers through Claxton Hepburn. There is some discussion about the state creating like a mobile testing van or testing site, and we're just at the beginning of trying to understand what that would mean. I think as we do more testing, we're going to have to emphasize, more innovative ways to do this, to be able to scale it to the degree that's going to be required. I mentioned last time that there's this option for doing either pooled or batched testing. So that's where you collect multiple samples, but then just run one test on those multiple samples. It's a way to reduce cost and save on the reagents. And the other thing is less invasive testing. So especially people who are being tested twice a week, it gets old to have somebody do a deep nasopharyngeal swab. So looking at oral sampling and also sampling of saliva may be an option. The other interesting thing that's come up is to do community surveillance by actually analyzing samples of wastewater. So it sounds like a peculiar idea, but basically you take a sample of the wastewater coming out of a village or a community, and you can screen to see whether there's COVID-19 RNA particles or virus in that wastewater. And then that helps tell you not which individual is infected, but it tells you that there is COVID-19 in that community. It's actually a technique that's been used in public health to do surveillance for the polio virus. So as the international community has looked to eradicate polio, it's very hard to test everybody for polio or to identify all the cases, but they test the wastewater coming out of villages. So it's a technology that's been around, and it's not going to replace testing, but it may help augment the testing that's being done. And again, it may make it more scalable and less expensive, which is a real concern for the community. I did want to say that there are a number of challenges from a public health perspective as we proceed through these stages of reopening. As everyone knows, we went through phase 1, and we've been in phase 2 with a little bit of a stuttering start on Friday. The North Country region still has a control room or control board that helps to monitor things, and St. Lawrence County has a task force that, of course, is helping to guide us. The timing for progression between the phases appears to still be sort of in the two-week intervals. We haven't really heard anything different coming out from the governor. And the criteria for advancing between stages still seems to be looking at testing and tracing, the number of new infections, the severity of infections, and the hospital capacity. There is a slightly different dashboard that's available on the website. It's called the Early Warning Monitoring System dashboard, and it has similar metrics to what we had seen in the past, the 7 metrics, but they're a bit different in terms of the most of the intervals are 7-day intervals that they're looking at. Dana and I have been working along with Ruth at coordinating with the local universities as they look to reopen the schools for the fall, which is a very critical issue for the community. Of course, we've been working with local businesses to make sure that they feel supported as we make these transitions. I do think a key challenge as we move forward is to really ensure that the public health recommendations don't end up being politicized, but rather that we understand them as simple interventions that we as individuals can do to protect our families, our communities, our healthcare, and our public safety workers. Wearing a mask, washing your hands, coughing into your elbows, staying at home when you're sick. These are all small measures, but they actually make a big difference as we reopen the economy. And I would just put out there that these aren't political acts or statements. They're just sensible preventative measures that are really essential for ensuring the health and well-being of our community. And I just feel like we all have to be mindful about that, and as leaders in the community, really put that out there. So just to summarize, fortunately, there's been no significant spike in new cases, despite going through phase 1 and now starting into phase 2. That's in the context of much more extensive testing, and not just testing of symptomatic people, but screening of asymptomatic people. The best way for us to detect a spike or a second wave continues to be expanded testing and screening. We have to look at these innovative measures because the financial burden of doing this frequent testing is real. The logistical challenges are real, and we need to figure out a more efficient way to do this as we go into the future. I do want to emphasize, however, that testing is not going to save us. It's really the mitigation efforts through public health. So identifying the cases through testing, but also doing the tracing, the isolating, and the containment. And then also there's really, as far as we're concerned, there's 4 pillars of the community health response. And those 4 pillars are appropriate mask use, social distancing, hand washing, and self-isolation when we're sick. So from public health, we really want to hammer home that those 4 pillars are critical. So again, it's exciting that we're restarting, we're renewing, we're reopening. However, how we go about this process is really going to dictate whether we're successful and whether we're safe as we transition through these phases. So that's my update.
Mr. Arquette.
Thank you. Dr. Williams, you said that we've had 11 cases since May 18th, and they've been realized through pre-op. So I'm assuming those were primarily asymptomatic cases?
That's correct. And some of the cases, some of those 11 cases were identified through preoperative screening.
Okay, and of those 11 and or throughout the 205 total cases, are the symptomatic cases generally resolved through quarantine or self-isolation?
Yeah, so the majority of people who have been either asymptomatic or symptomatic are staying at home in isolation, they're recovering, and then are able to return to work or to their family without having to be in the hospital. So we've only had 34 people who've required hospitalization up to this point.
Thanks for all you're doing. Thank you.
Ms. Hager.
Thank you, Mr. Chairman. Dr. Andrews, so of the people that were asymptomatic, did you have to do contact tracing on those people?
Yep. So, and that's a big part of that's pretty much what Dana and his crew is spending tons and tons of effort doing. Is even if someone's asymptomatic, there's very good information that those people are still contagious. So really, the contact tracing and the containment plans end up being the same, largely the same as for symptomatic people.
Okay, thank you.
Mm-hmm.
Dr. Williams, I have a question.
Sure.
Hi, it's Rita. What is the interval before pre-op testing that they're doing now? Is it 24 hours before they do the surgery?
So the guidelines require the testing to be done, I believe, within it's either 3 or 4 days of the procedure. And that's partly to allow for regions like our region where much of the testing has to be sent off to reference labs. Ideally it would be done more proximate to the surgery, but I think that was a compromise, understanding the logistical issues that more rural communities and hospitals face.
Okay, thank you.
You're welcome.
Mr. Akers.
Thank you, Mr. Chairman. Dr. Williams, what is are there any new statistics from the CDC as to concerning the morbidity of this actual disease with all the testing that's been taking place? I mean, the initial was the calculation that it was over 3%. Do you know where it is? Is there a declaration of actually where it is now?
So I don't think anyone has settled on a final number, but you're correct. What's happening and what's happened in every country where we've seen this is the more testing that's done and the more low risk people who are tested, you tend to see the mortality and morbidity rate decrease significantly. And that's what we found.
So is it similar to the influenza, or we know it's highly more contagious, but actually is the morbidity, is it similar to getting a bad flu?
At this point, until the numbers have settled down, I wouldn't necessarily say that. I will tell you that, taking care of these patients, the disease itself is quite different from the flu, and it has a lot of manifestations that, from a medical perspective, are challenging, perplexing, difficult to manage. The flu, of course, can and often is deadly in certain populations, but this is a very aggressive, difficult to treat virus when it infects certain people who seem to be more vulnerable.
Okay, thank you.
Yep.
Anyone else have a question for Dr. Williams? Mr. Burke? John, you're on mute.
Sorry,
Okay.
apologize. Dr. Williams, the people that are asymptomatic, is that same percentage hold true for St. Lawrence County, do you think, or for our area, as it does on the national level? I guess, I don't know, there's been some estimates that up to 50% of the people that are tested that test positive could be asymptomatic. I guess I'm just wondering if you have any thoughts on how that might relate to St. Lawrence County.
Yeah, I mean, I would say that in general, all the epidemiology that we see in St. Lawrence County mirrors what you see in other rural communities. As far as, the percentage of people who are asymptomatic when they're diagnosed, that percentage is going up as we're doing more screening, of course, as you would expect. I think when we've looked at the numbers, and Dana can speak to this, that it's not 50%, it's maybe more like a third or a quarter of the people who are positive have been asymptomatic up to this point. Again, once we do more screening of asymptomatic people, you would naturally expect that percentage might increase.
Thank you.
Okay. Anyone else? We'll move on to Dr. McGuire.
Thank you. And thank you, Dr. Williams. As always, he kind of steals my thunder on just the numbers we have. But so we do have 205 cases right now. One is in the hospital, but it's outside of our county, although it's our case. We have 123 people who are in quarantine right now, and we have 18 who are in isolation. We've had about 1,400 or more people who have been done with the quarantine and the isolation process. And so just to go back, it doesn't matter whether you have symptoms or not, we still do put you in quarantine or into isolation. The people who are in isolation, those are the people who are positive. The guidance has now changed for New York State that instead of just the 7 days since the symptoms started, it is now 10 days. And so you have to be 10 days since the symptoms started, and you have to be free of a fever, and then the respiratory symptoms had to just greatly improve. With regard to what we've seen since the reopening, we've had just 11 cases since phase 1 started, and 5 cases since phase 2 started. So that's less than a case per day. During the last week, we've seen more of the screening due to the elective surgeries and things, and we've had just 50% of the cases be due to that. And so that just kind of shows that we are seeing more of the asymptomatic cases. And that's why it really is important to be considerate and to wear a mask, because we will see more people who don't have the symptoms just could be positive. We are meeting with the superintendents of all the schools. We are talking about the graduation ceremonies and trying to give just some of the guidance that they could do. The hard part is that the phases and the executive orders don't always mix. And so just because we move to a new phase, this doesn't necessarily mean that we'll have some of the new guidance for how many people can do the gatherings. So that's the hard part. As we moved from phase 1 to phase 2, we did not see that the number of people who can get together had changed. We continue to take calls from the community, helped just to navigate through the website to help people understand what is necessary. And then over the weekend, the reopening work group did work pretty hard in trying to get face masks and things to the hairstylists that will be opening. So that's what I have for my report, but if there's questions, those as well.
Any questions for Dr. McGuire? Mr. Forsythe?
Thank you. Can you hear me?
Yes.
Okay. Thank you, Dana. There's some protesting taking place. Potsdam, I think Ogdensburg's having one tonight. I guess they're stealing the thunder of the COVID-19 to an extent. My question is, what sort of social distancing are we watching with that? Is there any? Is anyone keeping tabs on this? Or it seems like there's been a lot of effort to curtail the social distancing, and all of a sudden it's coming alive this way. So I just wonder if there's any effort or any concern.
There is concern because we should be maintaining that for all activities. Those complaints do go to Ruth, the sheriff, and the county attorney, so I can let them speak to that and what's being done.
Okay, if anyone's got information, I'd be curious.
Okay. Joe, would you like Steve to speak?
Yeah, County Attorney, would you mind responding?
I don't mind at all. Good evening, everyone. This was the source of a piece of discussion that the Coronavirus Task Force had earlier today, and we've really been having over the course of the past weekend. But clearly, with protests that are occurring in Albany, New York City, that are occurring in Buffalo, Syracuse, Rochester, the size and magnitude of those protests, especially in light of the fact that many of the protesters are not wearing masks, sends a conflicting message with what I believe public health and what I believe the governor has been attempting to communicate over the course of the past 3 months, which is that we are supposed to continue to socially distance. We are supposed to minimize gatherings to 10 or fewer individuals. In fact, just on, if I recall correctly, May 27th, Executive Order 202.33, which actually replaced 202.32, announced that everybody could gather for any reason, but no more than 10 people at any one given time, while still having to observe the 6-foot distancing, the appropriate population density reductions, as well as appropriate mask wearing. So this obviously is creating a bit of a problem for us. I think everyone on this board is cognizant of the right of free Americans to communicate their grievances clearly in the fashion that they need to in order to communicate to the government. But I think we're having difficulty finding that balance with how we relate to them, that they need to communicate it in a safe and appropriate fashion to continue the work that public health has been engaged in over the past several months, so that we don't have another situation where our numbers increase.
Thank you, Steve. Yeah, it just seems like there's been an awful lot of work that's transpired in the last 3 months and could all go for naught in just a couple of nights. So thank you.
Mr. Akers?
Yes, I inquired of Dana on Sunday about the 1-800 number and the complaint line, or the website, and she responded. So knowing that Ruth and Steve and the sheriff are the ones that are handling these calls, how many have we actually had?
I can speak to that, Joe. Can I
Go
speak to
ahead.
that? We have had 68 complaints since the line was open, received as of this morning.
And so what is the procedure? You send the county attorney out? Do you send the sheriff out? What happens?
So each complaint is reviewed. I believe that there have been, in some cases, letters from the county attorney's office explaining the proper protocol. I think in some instances, there have been patrols sent along on an education and awareness effort. And in all cases that we have reached out so far, folks have been very compliant and we have not had to revisit. So I think that it's been, a measured response because most of the complaints, there are some pointed complaints about gatherings, but mostly it's about mask wearing or not wearing at store locations, social distancing in retail locations, and concerns about gathering in the pickup aspect of things outside of establishments, which is a very difficult thing for the business owners to be on the exterior of the building while folks are waiting, monitoring that social distancing. So many of them have been covered in just those areas I've mentioned. But in the more challenging ones, we sit down, we go through them, and come up with an appropriate response and then dispatch that order out to the public. We have been challenged by this last Thursday and Friday, I will tell you, being concerned about the enforcement of folks moving ahead in the regard they see fit. So we are being very careful, reviewing every complaint that comes in and agreeing upon how we should respond.
And I guess I have a question for the county attorney. It is an executive order. Is that executive order constitutional?
Well, Mr. Akers, there are actually 36 executive orders that have been issued since this began. The primary is 202, but there have been, as I indicated, sub orders that have been issued off of that. If you look at Executive Law Section 29-A, statutorily it appears that the Assembly and the Senate have previously passed bills that empowered the governor in times of emergency to enact certain suspensions and modifications of statutes that are on the book. So, utilizing that authority that is included in Executive Law Section 29A, that's exactly what the governor has done. In fact, I have compiled and cross-referenced. I think I saw an article at one point that said that there had been 262 laws over the course of a 55-day period. I can tell you it's probably closer to 450 laws and regulations that have either been modified or suspended during this time period. But getting to your specific question as to whether or not it's constitutional, each one would have to be analyzed individually to determine whether or not certain activities were and certain activities are not. Generically speaking, empowering the executive within state government with the ability to suspend or modify statutory law is most likely constitutional.
State constitution, you're saying?
That's correct. Although I will note that this past week, the U.S. Constitution, the United States Supreme Court had opportunity to review a matter that had emerged out of the state of California and separately reviewed a different matter that emerged out of the state of Illinois. They actually reached somewhat divergent viewpoints with respect to both of the positions, but in ruling on the constitutionality of restrictions on gathering sizes in California, the Supreme Court did indicate that it was within the state's power to issue the executive orders limiting those gatherings to no more than 100 people. That was the limit that they had there. So whether or not it would apply to limiting a gathering of 10 or more people, or 10 or fewer people, that issue has not theoretically come before the court. That was raised by the Illinois matter that came before SCOTUS. But I will note that just prior to the decision being able to be rendered, the state of Illinois rescinded that executive order to make the matter moot.
I just read a short brief on the California case where Roberts aligned with the other four on that ruling. My concern is that, according to the release of information, that the fines could be up to $1,000. And so if you have a gathering, say outside of a restaurant that's doing takeout, that is more than 10, maybe 15 or whatever, it's a group that are traveling together, whether maybe it's ATVs or something else, then the establishment would be subject to the fine, I would expect. So have any fines been administered in St. Lawrence County?
Mr. Akers, I did want to correct something that you communicated. There are individual fines that may be assessed against individuals, people, specific individuals. of $1,000. However, under Public Health Law Section 12B and Public Health Law Section 12, which are the empowering statutes that the governor has cited in his executive orders as authorizing local governments to execute this power, there is a different fine structure that ranges from $2,000 for first offense, $5,000 for second offense, and up to $10,000 on the third offense and each offense thereafter. Now, I can tell you from a civil perspective, on the letters that have been issued to the businesses, no fines have been leveled by St. Lawrence County against any businesses associated with a violation or alleged violation of any of the executive orders at this time.
Thank you very much, Mr. Button.
Anyone else? Well, Dr. Williams and Dr. McGuire, thank you for taking time. I know you've got probably a lot of lag time during the day that allows you to come here at night, but you're doing a great job from what I'm hearing from the control room anyway, and from Sylvia Getman, and who is very impressed with both of you, as are we here. So thank you again very much, and thank you for coming and letting us ask questions and get some help in dealing with this, with the phone calls that we get, and we are getting a lot of them. So thank you again very much.
Thank you.
Mr. Akers, would you present the resolution regarding June and Dairy Month?
Mr. Chairman, it is my honor to honor the hardest working people on the planet by declaring June as Dairy Month.
Is there a second? Seconded by Mr. Forsythe and Ms. Curran. Is there any discussion? Seeing none, all in favor?
Aye. Aye.
Opposed? Carried. At this time, I'd like to introduce 1, 2, 3, 4, 5 of young people that represent the dairy farms, the dairy industry. They are promoters of that avocation. Josh Godbout, excuse me. Sarah Brody, Elenia Wainwright, Caitlin Popman, and Michael Pierce.
Can you guys hear me fine?
Are we going to get those folks up?
Yep, I think some of them are coming up right now.
All right, some are coming up. I don't know which
hear
one
me?
of you want. Yeah,
There we go.
I don't know which one
Camera's
of
a
you
little
wants
off.
to start, but I will leave it up to you to decide who's going to start and go next. So
There we go. Camera's a little better.
there you go. Joshua, are you number one?
I am.
All right, have at it.
Hi, I'm Joshua Goodboo, the 2020-2021 State Lawrence County Dairy Program Leader. I'm an employee at Woodcrest Dairy, LLC. I hope everyone has been safe and healthy through these unforeseen times. As we have learned that our local farmers were able to adapt to the local health department guidelines, we knew we had to as well. As we patiently discover new ways to educate our community from a distance, we are learning about the use of virtual conferences as well as social media that give us the ability to educate the importance of dairy consumption and agriculture. On behalf of the St. Lawrence County Dairy Promotion Corps and Committee, we thank you for having us here tonight to introduce ourselves and to further extend our thank yous to the dairy farmers, as we are proud to promote an essential industry. I would like to take the time now to allow the court members that were able to make it tonight to introduce themselves.
Hello everyone, my name is Sarah Brody. I'm a Dairy Princess alternate. I live on a small farm just outside of Canton, and I've been in the Dairy Princess program for 3 years.
Elena Wainwright, are you next?
Elena Wainwright was not able to make it tonight.
Okay, how about Caitlin Popman?
Hello, my name is Caitlin Putman. I live on an 80-cow dairy farm named Putman Farms, and I have been in this program for 4 years, and I've been a dairy ambassador, and this is my 3rd year as a dairy ambassador.
Thank you. And Michael Pierce.
Looking to the list, it looks like Michael Pierce wasn't able to make it as well.
All right. Well, this is a little bit different than what we're usually used to. You're going out in the hall and getting a little dairy refreshment. We miss it. Maybe before the end of June, if we ever get back to normal, we can do that. So we thank you for coming. Thank you for being good ambassadors for the dairy industry and the dairy farms that are here in St. Lawrence County, and some of which you come from. And we appreciate very much your coming here and advocating for the dairy industry. It is the #1 industry in St. Lawrence County, and it is one important business that we are very interested in seeing flourish. So thank you very much. We appreciate you coming. And like I said, I hope that maybe we can do this towards the end of the month if this ever lets up. So thank you again.
Thank you.
Thank you.
We will move next to communications.
A letter was received from the Village of Potsdam Administrator Greg Thompson on behalf of the Board of Trustees of the Village of Potsdam, asking for action to be taken and in favor of creating legislation which would impose the full 8% sales tax rate be implemented on marketplace purchases as well as in-person sales. The current pandemic and social distancing practices have led millions of Americans to begin shopping online, and local municipalities stand to lose millions of dollars in internet sales tax. That's all.
That's all. Next is time for citizen participation, and we have I guess a special way of doing this if we have any.
We did not receive any.
We did not receive any. All right. Well, the process is you can email us or send us a letter and with a question or a comment, and we'll be glad to address it at our meeting. The next one will be in July. Next, we'll proceed to the presentation of resolutions. Mr. Sheridan.
Thank you, Mr. Chairman. I have a resolution authorizing the chair to sign a marketing and licensing agreement with Walk with the Doc, and I move for its adoption.
Is there a second? Second by Mr. Perkins and Ms. Curran. Any discussion? All in favor?
Aye.
Aye.
Opposed? Carried. Mr. Sheridan.
Chairman, I have another resolution authorizing the chair to sign a contract with Jack Beneski, CPA and Associates, to prepare the preschool and supportive health services annual Medicaid cost report for Public Health Department for the July 1st, 2020 to June 30, 2021 program year. I move for its adoption.
Is there a second? A second by, I can see your hand, but there you go. Ms. Curran and Mr. Forsythe. Any discussion? Seeing none, all in favor?
Aye.
Aye.
Opposed? Carried. Mr. Sheridan.
Mr. Chairman, I have a resolution authorizing the chair to sign 2020-2021 emergency preparedness program contract for the Public Health Department. I move for its adoption.
Is there a second? Second by Mr. Fay, Mr. Perkins, and Ms. Curran. Any discussion? Seeing none, all in favor?
Aye.
Aye. Opposed? Carried. Mr. Sheridan?
Mr. Chairman, I have another resolution proclaiming June as the start of a year-long campaign encouraging safe sleep practices and well child care in St. Lawrence County, and I move for its adoption.
Is there a second? Second by Ms. Curran. Rita, I could see the sign, but you had your hand in front of your face and I couldn't see who it was. Seconded by Ms. Curran. Any discussion? Seeing none, all in favor?
Aye.
Aye.
Opposed? Carried. Mr. Denisha.
Mr. Chairman, I offer a resolution authorizing the addition of 6 parcels totaling 583.3 acres to Agricultural District 2 in St. Lawrence County, move for its adoption.
Is there a second? Seconded by Mr. Akers, Ms. Terminelli, and Ms. Curran. Any discussion? Seeing none, all in favor?
Aye.
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 Opposed? Carried. Mr. Denisha.
Thank you, Mr. Chairman. I offer a resolution modifying the 2020 budget for the Planning Office for Public Transportation Services, move for its adoption.
Is there a second? Second by Mr. Fay, Mr. Forsythe, and Mr. Perkins. Any discussion? Seeing none, roll call, please.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
yes,
Burke,
Yes.
Arquette,
yes,
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Denisha,
Yes.
13 yes.
Resolution passes. Mr. Denisha.
Mr. Chairman, I offer a resolution modifying the 2020 budget for the Office of Emergency Services for a computer-aided dispatch and records management technology services program and move for its adoption.
Is there a second? Seconded by Ms. Curran and Ms. Terminelli. Any discussion? Roll call, please.
Akers,
Yes.
Fay,
Yes.
Haggard,
yes,
Burke,
Yes.
Arquette,
yes,
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Denisha,
Yes.
Perkins,
Yes.
13 yes.
Resolution is carried. Mr. Denisha.
Mr. Chairman, I offer a resolution authorizing the chair to sign a 1-year extension with New York State Division of Homeland Security and Emergency Services Office of Interoperable and Emergency Communications for fiscal year 17 statewide interoperable communications formula grant and move for its adoption.
Is there a second? By Mr. Perkins and Mr. Forsythe and Ms. Curran. Any discussion? Seeing none, all in favor?
Aye.
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 Opposed? Carried. Mr. Denisha.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Midstate Communications for the interoperable radio site developments in Governor, Hammond, and Waddington and move for its adoption.
Is there a second?
Second.
Second by Ms. Curran and Mr. Sheridan. Any discussion? Seeing none, all in favor?
Aye.
Aye.
Opposed? Carried. Mr. Denisha.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with New York State for a HAVA Cares grant for the Board of Elections and move for its adoption.
Is there a second, please? By Ms. Terminelli, Ms. Curran. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Denisha.
Mr. Chairman, I offer a resolution authorizing the chair to sign a fiscal year 19 Operation Stone Garden Program grant with New York State Division of Homeland Security and modifying the 2020 budget for the sheriff's office and move for its adoption.
Is there a second? By Ms. Curran, Ms. Terminelli, and Mr. Forsythe. Any discussion? Seeing none, roll call, please.
Fay,
Yes.
Haggard,
yes,
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Aye.
Reagan,
Yes.
Forsythe,
yes,
Lightfoot,
Yes.
Sheridan,
yes,
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
13 yes.
Resolution is carried. Mr. Denisha,
Mr. Chairman, I offer a resolution authorizing the chair to sign a memorandum of understanding and a contract with the Rural Law Center of New York for indigent appellate representation and move for its adoption.
is there a second? Second by Mr. Akers. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Akers,
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Stantec Consulting Services for engineering and design services for County Route 35 Bridge over Trout Brook, bin 3341-700, pin number 775394, and modifying the 2020 budget for the Department of Highways. I move this resolution.
is there a second? Second by Ms. Curran. Any discussion? Seeing none, roll call, please.
Haggard,
yes,
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
yes,
Forsythe,
yes,
Lightfoot,
Yes.
Sheridan,
yes,
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
13 yes.
Resolution is carried. Mr. Akers,
Mr. Chairman, I offer a resolution approving federal aid highway project for the preliminary engineering and design for the St. Lawrence County Bridge Preservation, 2 bridges, bin number 3340-980, bin number 3341-780, and pin number 7753-96. I move this resolution.
is there a second? By Ms. Curran, Mr. Denisha. Any discussion?
Yes.
Mr. Burke. Mr. Burke.
Yes, I will be abstaining from this and the next resolution due to my employment.
Thank you. So noted. Any further discussion? Seeing none, all in favor?
Aye.
Aye.
Opposed?
Abstain.
Carried. One abstention. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Delta Engineers, Architects, and Land Surveyors, DPC, for engineering and design services for the St. Lawrence County Bridge Preservation, 2 bridges, bin number 3340-980, bin number 3341-780, pin number 7753-96, and modifying the 2020 budget for the Department of Highways. I move this resolution.
Is there a second by Mr. Denisha, Mr. Fay, and Ms. Curran? Any discussion? Seeing none, roll call, please.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
yes,
Lightfoot,
Yes.
Sheridan,
yes,
Denisha,
Yes.
Perkins,
Abstain.
Akers,
Yes.
Fay,
Yes.
Haggard,
yes,
12 yes, 1 abstain.
Resolution is carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the acceptance of real property obtained by New York State relative to Depot Street over Deer River Bridge Replacement Project, pin number 775386. I move this resolution.
Is there a second? Mr. Forsythe and Ms. Curran. Any discussion? Seeing none, roll call, please.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
yes,
Denisha,
Yes.
Yes.
Perkins, Akers,
Yes.
Fay,
Yes.
Haggard,
yes,
Burke,
Yes.
13 yes.
Resolution is carried. Mr. Akers?
Mr. Chairman, I offer a resolution approving federal aid local project supplemental agreement number 2 for final design for Depot Street over Deer River, bin 322850, pin 775386, and modifying the 2020 budget for the Department of Highways. I move this resolution.
Seconded by Mr. Arquette. Any discussion? Roll call, please.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
yes,
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
yes,
Burke,
Yes.
Arquette,
Yes.
13 yes.
Resolution is carried. Mr. Akers?
Mr. Chairman, I offer a resolution approving federal and local project supplemental agreement number 2 for the right-of-way incidentals and acquisition for Depot Street over Deer River, bin number 3220850, pin 775386, and modifying the 2020 budget for the Department of Highways. I move this resolution.
Seconded by, excuse me, seconded by Mr. Arquette. Ms. Curran, any discussion? Seeing none, roll call, please.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
yes,
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
yes,
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
13 yes.
Resolution is carried. Mr. Akers?
Mr. Chairman, I offer a resolution adopting the mortgage tax report. I move this resolution.
Is there a second? By Ms. Curran, Mr. Fay. Any discussion? Seeing none, all in favor?
Aye.
Aye.
Opposed? Carried. Mr. Reagan?
Yes.
Your turn, Jim.
You can't find it?
No.
Authorization to fill
Oh.
vacancies?
Okay. Mr. Chairman,
You're going to offer that resolution?
yes, I would like to offer a resolution authorizing the filling of vacancies.
Is there a second? By Mr. Perkins, Mr. Forsythe, and Ms. Curran. Any discussion? Seeing none, all in favor?
Aye.
Aye.
Opposed? Carried. Mr. Denisha?
Mr. Chairman, I'd like to offer a resolution for the reappointment of a public defender and move for its adoption.
Is there a second? Second by Mr. Forsythe. Mr. Forsythe, Mr. Arquette, Mr. Sheridan, Mr. Akers, Mr. Reagan, Mr. Burke, you too?
Yes.
Anyone else? Mr. Manelli and Mr. Perkins. Any discussion? All in favor?
Aye.
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 Opposed? Carried. Mr. Forsythe.
Mr. Chair, I'd like to offer a resolution approving a one-year extension of the agreement between the County of St. Lawrence and the City of Ogdensburg in relation to the allocation and distribution of money collected from the sales and compensating use taxes imposed pursuant to Articles 28 and 29 of the tax law, and authorizing the chair to sign the amended agreement and move for its adoption.
Is there a second? Seconded by Mr. Perkins, Mr. Reagan, Mr. Akers, Mr. Denisha, and Ms. Curran, and Mr. Arquette. Well, before we get going, it needs to be amended. And as I told you earlier, and I think everybody said that they had received a copy of the portion of the resolution that needed to be amended. Mr. Forsythe, if you would be so kind as to offer that as an amendment, I'd appreciate it. Do you have it?
I would love to be that kind, but I don't have a copy of it in front of me.
All right, Mr. Akers, do you?
No, I don't, because it's on my iPad and I'm working off the old school paper here.
Here's a simple solution. I'm going to read it, and I would like one of you to move it, please.
Okay.
And this is to remove in its entirety the 8th whereas and replace it with the following whereas. Whereas if by November 30th, 2021, should the parties fail to reach an agreement concerning the allocation and distribution of monies collected from the sales tax and compensating use taxes receivable commencing December 1st, 2021, the county reserves all rights and privileges accorded to it under the New York State tax law. Is there a motion to move that? Mr. Forsythe, seconded by Mr. Akers, Mr. Denisha, Ms. Curran, Mr. Arquette, Mr. Perkins, Mr. Fay. Any discussion on the amendment? Mr. Reagan.
Mr. Chair, could we ask the county attorney for an explanation of the amendment?
You want me to do it?
I'd be more than happy to.
Go ahead.
Thank you. There are certain modifications that were made at the request of the Comptroller's office. As I believe that you're aware, under the tax law, when an agreement is reached with a city wholly comprised of a geographical region solely contained within a county, that the Comptroller has final approval. Many of the changes were, in my mind, superfluous. For example, under a prior draft, it indicated an amendment, but under the successive draft with the Comptroller, they wanted amended agreement. Also, the recommended change that I think removes the date that Joe had identified, or the chair had identified, it specifically referenced the period of December 1st of 2020 through the November 30th period of 2030. And that's really unnecessary at this point because it's not going to be a 10-year term. If you reach a successive term, it may be 9 years, it may be fewer years than that. So I think the recommendation for that modification is driven solely by the fact that there's no intention at this point to hamstring the county or the city into any specific duration of any successive agreement, other than to say that this is a one-year extension of the exact terms that we have right now as is.
Thank you, Mr. Chair.
Any further questions on the amendment? All in favor of the amendment?
Aye.
Aye.
Opposed? No one opposed. Back to the original resolution now. All in favor of the original resolution?
Aye.
Aye.
Any opposed? Carried. Thank you. Mr. Denisha.
Mr. Chairman, I offer a resolution authorizing the chair to sign the Federal Transit Operating Assistance Agreements, the Coronavirus Aid, Relief and Economic Security, the CARES Act, and modifying the 2020 budget for the planning office and move for its adoption.
Is there a second? Second by Ms. Terminelli, Mr. Perkins, Mr. Fay, and Ms. Kerr. Any discussion? Seeing none, roll call, please.
Reagan,
Aye.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Denisha,
Yes.
yes,
Perkins, Akers,
Yes.
Fay,
Yes.
Haggard,
yes,
Burke,
Yes.
Arquette,
yes,
Terminelli,
Yes.
Curran,
yes,
13 yes.
Resolution is carried. Now we come to the county administrator's report.
Okay, a few items to update you on this evening. I wanted to remind you that there is no meeting scheduled for next Monday, June 8th, with 5 Mondays in June this year. That is the meeting where we will not get together. Then there will be single committee meetings through the rest of the month. So operations will fall the 15th, services the 22nd, and finance on the 29th. A few items COVID-19 related. I just wanted to mention this last resolution. I appreciate you taking a look at it and adopting it. That allows both the Arc of Jefferson County and Volunteer Transportation to recoup some of the funding. As you know, they've not been collecting fares. And as you know, the contract with the College Connectors was stopped mid-semester. So those are areas where they've lost revenue. And this will allow them to reap some of the revenue available to them through the federal benefits. So I appreciate you looking at that in short order. I did mention to Mr. Akers the 68 complaints that we've received, and the response has been favorable. We will meet with the superintendents tomorrow, and I think it's an opportunity for both Dana and Dr. Williams to communicate their concerns. You probably are already seeing some of the scheduling of different types of graduations, as well as the beginning of some invitations to graduation celebrations. And that's going to be a real challenge for us, much like we talked about with the gatherings that are happening today, to be able to remind those 4 pillars that Dr. Williams spoke to at the end of his comments tonight, and how important they are to prevent the spread of COVID-19. Over the weekend, you might have seen that we were able to help with the hair salon and barber shops in distributing over 150 face shields. We also handed along some of those cloth masks to go with them, because if you reviewed the guidance or the mandatory requirements, they have to wear a face mask and a face shield. So some of those folks have been closed, and we wanted to make sure that they had access, or for their customers coming in, that they would have access to masks as well. We have placed some of those face shields strategically around the county. If you hear of anyone in need, please let us know, and we'll make sure that they get one. That seems to be one of the areas of PPE that we didn't have a great demand for, and that we understand that the hospitals and nursing homes are receiving their own shipments of. So we do still have about 400 in our storeroom, but we also do have many deployed around the county. So our hope is that no one will go without providing services because they don't have a face shield. Also, that mobile testing site that Dr. Williams mentioned, we're working as a region to determine if that's something that we could do. With the requirement of the hairdressers to have testing every 14 days, there may be a number of barriers and challenges for them to access that requirement. We certainly, and they were instructed that following their test, they do not have to shutter their doors, much like we've required folks post-test to wait until their results before they return to work. So that was a little bit of a relief, I think, that they didn't have to go every 14 days and shutter their doors for up to 3 days. So that was something that we're working as a region on. We'll keep you posted. Our intent would be, as Dr. McGuire mentioned, to appeal to some of those areas where we haven't had cases, to make sure that there aren't cases there with asymptomatic folks, or to make sure that we at least sample the area, as well as get to some areas that are farther from Canton, Potsdam, and Ogdensburg that folks might have more difficulty getting to. Two measures of precautions that I'm looking at for county staff. I shared this with them last week, and we're looking at some county policy to address that. I did share that also with the unions. And those are temperature checks. When we move back to right now towards the end of June, but when that happens, I'd like to consider having temperature checks at the doors of our facilities with a basic questionnaire like you're seeing when you go into many facilities these days. We have been doing that at the correctional facility since it began, and we are now doing the temperature and at emergency services, or when we have the emergency operations center, as well as last week we began doing temperature checks at public health. So that is one area I think that would be valuable to take a look at, and working with the courts as well for the courthouse. Secondly, I've talked both to the work group for the coronavirus work group and the reopening task force about getting the opportunity for volunteer testing of county staff. And we could provide this opportunity either as they merge back into the workforce or prior to their return. So those are a couple of areas I was able to talk with the union about, and they didn't express great concern or objection. Now keep in mind the testing would be exclusively voluntary. We would not require anyone to have a COVID test to be able to come back to work at this point. And we would look at, we have ordered some thermometers, and we would have the basic health questionnaire about having a temperature or feeling sick in the last period of time. Also, I wanted to mention to you that an assessment's been completed of all the modifications that are required for county offices. We have not yet completed those for our satellite offices, but they would likely model the offices here in Canton for safe social distancing. In many cases, the plexiglass type setup that you're seeing in the stores, but situations where both the public coming in and our employees who have to share office space would be comfortable and safely able to provide services. So those are things we're looking at now. And as you might imagine, with hand sanitizer and many of the items that became difficult to get, as people move toward reopening, plexiglass and things of that nature are becoming very difficult to get. And the cost of those are also increasing by the day. So we're trying to make sure that we get an inventory of those items and get those modifications made. There's not great a number, and I don't expect that they'll be terribly expensive, but I'll bring those numbers back to you when we're able to get that collected. We will then do an assessment of the satellite offices as well. The DMV office in Canton has already had the modifications made, so when we are allowed to provide services to the public, we will be prepared. I did want to mention regarding the colleges that Dr. Williams and Dana mentioned, the status on SUNY Potsdam, just as an example of those returning, they've seen 101 individuals return to collect their belongings. That's about 51% of the people in the opening regions, in the reopened regions. And the highest that they've had on any given day, they had 2 days of 11 students and 1 day of 10. And this has been since May 22nd that they've been doing this. On some days there are none, or 1 or 2, but they are excluding New York City right now and Long Island. So they're working to make considerations for the anticipated opening of phase 1 in New York City June 8th. And also the traveling through New York City that most of the folks from Long Island will need to do to come up to St. Lawrence County. So I did want to mention those aspects to you about COVID-19. Moving on to vacancies, there is a scheduled vacancy review committee meeting tomorrow, and it has 3 scheduled for consideration. The numbers have dropped precipitously since March. Currently, there are 68 vacancies in the county positions. And I wanted to talk with you, and I'll talk more with you about this at Finance, to consider what the options and weigh the benefits and the disadvantages of moving back to formally instituting a hiring freeze. In our vacancy resolutions from 2008, we talked about a hiring freeze for non-essential workers. So that is an area that you could either reinstitute what it was or choose your own course of action. And related to that, it did exclude those 2 groups. The one I mentioned, which would be essential, and the revenue generating positions. So those were excluded from the hiring freeze at that time. You also, as I mentioned to you at Finance last month, have the option to move back toward the 30, 60, or 90 days to fill any of the positions. Currently, we're at, I believe the last time I reported to you, a 95% immediate fill. So there are some options available there as well. But departments are moving. This last week, I had our monthly department head meeting. They're moving from a quarterly budget review to a monthly budget review. And they'll be identifying areas of budget reductions as well as potential revenue shortfalls that they're beginning to see. As you recall, in the first quarter budget review, the financial update that we provide each quarter, none of this had been impacted yet. So we expect that March now will start to reflect that in the claims, April and May, and as we move into June. So we'll be looking at those in the next week, and the budget team will become more active in terms of looking at how we may protect and preserve 2020's budget. At operations next week, or I'm sorry, the 15th, I've requested that a lead grant update. Many of you will remember at the end of 2018, St. Lawrence County was successful in receiving a $1 million lead grant, a federal grant. And there have been some challenges associated with that. I've asked for an update to that. If Larry, that would be okay with you. I would like to have planning come in and talk about the challenges that they faced, the efforts that they are making to get the work done. And certainly Chairman Lightfoot, I think, has received some information updating over the period of time about how the assessments, that is the lead grant. So they're doing assessments and then remediation in areas of the county. And we certainly are all aware that that is a problem for us. So they'll bring that to you. And then at finance, as I mentioned to you last month, I will give you an update on a reserves recommendation as well as the fund balance policy, and bring you an update on the measures that we can take, that we can identify at this time related to the 2020 budget. Any questions?
Mr. Akers and then Mr. Denisha. Mr. Akers, go ahead. I think you're on mute.
Yep, I was. Thank you. Under the definition of essential, what workers would that include at the county level?
Well, currently, the essential workers are identified as tied to the COVID-19 response. But typically, those are the 24/7, 365 operations.
Okay. Thank you.
Mr. Denisha.
Yes, thank you, Mr. Chairman. Ruth, in regards to the meeting that you're having tomorrow with public health and the superintendents, I guess the thing I would like to make sure that everyone remembers is that much like St. Lawrence County is different than New York City, we've got a lot of smaller districts, smaller graduating classes, and they're certainly different than the larger ones. So I just want to throw it out that while the precautions need to be the same, one size does not fit all. So we've got some schools that are graduating, less than 30 kids. We've got schools that are graduating well over 100. So the needs of each one are different. I just want to make sure that that's considered. Thank you.
Certainly.
Anyone else? Mr. Forsythe?
Yeah, Ruth, thank you for the update, especially on the DMV issues earlier today. That's kind of a sticking point with me. I just feel we're taking baby steps with DMV. Car sales are starting to pick up. My office was busy, very busy today with car sales. So I think we have to be ready. There's a lot of 16-year-olds that have become permit eligible since March 18th. They're itching to get their wheels under their feet. I don't blame them. My office itself is worked out of a crank out window, but I'm servicing my customers through a crank out window by any means possible. I think if we're going to open satellite offices, somehow we have to get public access, whether we punch out a window and put something in that they can transfer between, or I know the Ogdensburg office particularly, 2 people could actually work in that office. I don't know about how you're going to clean it and things, but I'm encouraging to take bigger steps with DMV. I think our constituents really are looking for that. The other thing is what I'm hearing from a lot of my private sector employer friends is I don't believe they're going to bring back the total number of people that they had prior to this. I think a lot of the businesses are realizing they're working a little bit harder, but they can do a lot more with less people. So I'm a little leery of what the unemployment's going to be in St. Lawrence County eventually, whether it'll be back to the low numbers we had, and coincidingly government numbers, which hasn't taken a loss. So those are things that I think are going to become issues as we move forward. But DMV is definitely a sticking point with me. So thank you.
Sure, a couple of things.
Mr. I'm sorry.
Can I speak back to that? Okay, Mr. Forsyth, I am keenly aware of those interested in a permit. I have a 16-year-old who turned 16 on March 31st, and a niece and a nephew because we all decided to have babies at the same time. So I'm keenly aware of the permit piece of this. We were anxiously awaiting that executive order to expire last Thursday night and prepared to reopen. However, that has changed. That change has been taken out of our hands. What we're doing now is making every effort to get everything ready so when we can reopen, they can take that business immediately. We are one of the only counties in the state to have a drive-through window. I think there may be one or two others. And I understand that there was a county clerk downstate that attempted to do that business by drive-through, taking all the precautions. The commissioner of the DMV, it was shared with me, shut it down after a 2-hour-long traffic line emerged, and the sheriff's office had to be called in to route traffic accordingly to keep it safe. So I don't disagree with you in any way. That's been one of our, as I mentioned, most popular departments of folks anxious to get back to. We do have drop boxes at every location, Messina, Ogdensburg, Governor. They are taking them in. Those boxes get filled, I'm told, every other day. They're collecting all of those items, processing and returning them. We are still receiving downstate totes, and those are being processed to the effect that we aren't even getting all of the work done while the doors are shuttered. So in an effort to get prepared for when they do reopen, and we have precautions ready of how many we'll allow in the building at any given time, we will be ready. And we continue to process business. We are adding 2 phone lines to the Canton line where most of the calls have been routed while the satellite offices have been closed to allow for more calls. More staff will be available to answer those calls, to get the forms out, to get the questions answered, to get those transactions processed.
Thank you, Ruth.
You're welcome.
Mr. Arquette.
Thank you, Joe. I was going to echo Mr. Forsyth's concerns. I'd had a lot of phone calls in that regard, but Ruth just answered the question very well. Thank you.
Anybody else? I think we're all set, Ruth. Are you all done? You done? Move on to old business. Any old business? Mr. Akers.
You do have committee reports, but I don't know what you have, but are there any committee reports? We are skipping to the old.
Give me a minute. Listen, if you give me a minute, I'll go back to it.
Okay, so just on the old and new business, Ruth, speaking of, could you give me and any other legislator that's interested, could you give me what the payroll will be for the CSA for the next 5 years, starting with 2020, with the 2.75% increase? And is it 583 or 587 employees is that based on?
587, I believe, Mr. Akers.
Okay, can you send that information to me and anybody else that wants it?
I will send it to the whole board.
Thank you. That's all I have, Mr. Chairman.
Thank you. Anyone else? Mr. Arquette.
Are we under old and new business or committee report?
Yeah, we'll stay with that, and then I'll go back to the committee reports.
Okay, I want to, if I could, very briefly bring up a
Go ahead.
delicate matter in politics, I believe, and that's ethics. I believe after our executive session, you'll be appointing a couple of different search committees. As the public knows, we just got done filling a vacancy. they're all for three different reasons, but one component that's similar with all three is the term ethics. And I know in government, ethics is a delicate term. Where my question lies, or my concerns lie, is that upon entering these officers, or upon running for these offices, people like myself, others on the board, many others on boards before us, had to go through an ethical determination by what I would consider to be a higher level of authority than the county ethics board. And I have full knowledge that this bodies previous to us created the county ethics board. And I do have respect for their findings, but where I'm frustrated and where I'm concerned is the fact that if you have a legislator that seeks a determination prior to running, they're successful. They come to the board and they do as that higher authority has told them they must do, which would be recusing from different subject matters related to their potential conflicts of interest. They're on record of doing that over periods of time. And then for whatever reason, we get weighed in from our county ethics board, and it's contrary to the findings of, again, what I consider a higher authority. Where my concern lies is I think what we're really trying to do, I think that everybody, the voters, this body, we're trying to find the best people to represent different districts within our county. And I'm just struggling to find out how our county board of ethics could differ in their opinions from higher authorities. And that's just a question I put out there. If anybody can help me with that concern, I'd be greatly appreciated.
I would have a question, Tony, is what higher authority are you referring to? So
well,
if somebody comparison here, I think it's fair to ask that question.
Right. Well, so if there's somebody like myself, there's JCOPE, it's a state level ethical board that deals with jobs like mine, or maybe teachers, people involved with state government with their primary employment. And again, have been deemed, for me, it's simple. Anything to do with the New York State Power Authority, I'm going to abstain. I'm going to recluse. I've done that. I've been on record of doing that since day one. Other people have had decisions rendered. They've adhered to those decisions. It's all documented. There's nobody that's voting off the record. So people are following guidelines. They're doing what they were instructed to do, what they were informed that they had to do at the onset. And then all of a sudden, findings come in from our county board of ethics that are, in my opinion, contrary or to the findings of these original boards. So it's a concern. I don't want to eliminate future potential candidates from offices because there's a perceived conflict when higher authorities look at it differently.
What I'd like to do is ask the county attorney to comment.
Thank you.
Or at least clarify.
Thank you.
Hello, Mr. Arquette.
Hey.
It's actually a rather simple explanation. While it would seem on its face to be, just as you've communicated, a higher authority, the state, JCOPE, having rendered an opinion that an individual may serve, the difficulty is that JCOPE's jurisdiction extends to reviewing state law. They review their own individual ethics rules. They identify general municipal law. They go over the conflicts provisions associated with general municipal law, and then they render an opinion solely based on the law that they have jurisdiction over to review. Similarly, an attorney who is a licensed professional who would sit on the Board of Legislators is not merely subject to the county's Board of Ethics local law, but also subject to legal ethics. We answer to the Grievance Committee, and the Grievance Committee will review us pursuant to the laws and regulations based on our profession, as would a medical doctor or a nurse practitioner. They have a separate agency that has a separate set of rules that they will review. So the question I think that you posed is, how is it that you could have a state body entrusted with reviewing a matter come to one conclusion, and reviewing the same matter, the county body could come to a different conclusion? They're looking at two different sets of laws. The state body will look at the state laws and evaluate the behavior based on the state provisions. The county board has been entrusted, based on the 2009 local law amended in 2015, to review with respect to our local law. The county board does not review the action based on the state laws that govern ethics. They only review associated to our county law. The state board similarly only reviews the state law applicability and does not review according to the county law. Similarly, the grievance committee would review my behavior as county attorney without any reference to the county ethics law. But the county board of ethics would be able to review my activity and my attention based on the county law. Does that clarify?
Mr. Chairman.
Go ahead.
It does, Stephen, and I do understand that, and I appreciate the level of clarification. But to me, with your clarification, it begs for us to take a look at the local law. Lot of noise. The local law that does speak to the scope in which our county ethics advises. I don't know if possibly we maybe need to look into the future to amend some of the laws that we have around the county, so that there's not not necessarily a duplication, but the opposite of a duplication as far as the findings of one board, and then another board. I hope everybody can understand the frustration here. That again, we have a professional group that says this is how that you need to move forward. It's acceptable, but you need to do this. We do it to the T, to the letter of that advisement, and we're on record doing so. And then there's a contradiction. So, and you've explained it, and I am not in any way argumentative. We have a problem here, in my opinion. And I really believe that we need to take a look as we move forward to make sure that that good people are not eliminated from running for these positions because of the ethical ramifications that are existing. Thank you.
Okay. Ms. Haggard.
Thank you, Mr. Chairman. Mr. Button.
Yes, ma'am.
Is there a delineated appeals process, or is there a process by which you can appeal the decision of the local board to the state board? Or are they just disjoint?
Actually, there are several processes that are identified. So it depends on the manner in which the matter appears before the Board of Ethics. For example, if an individual were to ask for an advisory opinion and they received an advisory opinion that they disagreed with, would there be a way to appeal that? Technically, no, because an advisory opinion is just that. It is not a directive. It is not an order. It is just advice. But let's say that a matter came before the Board of Ethics with respect to a complaint. And that complaint, which has different rules under the Board of Ethics local law, were acted upon, and an individual felt aggrieved by that determination. Would they be able to challenge that? Yes. There is a process. It's through an Article 78. They would file it in the county in which the matter arose. Obviously, here in St. Lawrence County, they would file it in the Supreme Court. We've actually had an incident where that, in fact, occurred during the course of my tenure here. I will note that the Board of Ethics findings were upheld under the Article 78 review.
Thank you.
Yes,
just one other thing. I agree with Mr. Arquette, because I'm thinking that in a county our size, where many of us are employed by state entities or some businesses, it makes it really difficult to eliminate people. We just don't have enough people to go around that are interested in doing this kind of work. It's anecdotal what I'm saying, but I agree with Tony on that. That there's got to be some way that that there's some provision or looking at the law to amend it in some way. Thank you.
Mr. Burke.
Along the same lines as Tony and Margaret, we recently lost 2 legislators because of ethical rulings, and again, don't pretend to be any expert in ethics, but having sat there and observed both of those individuals, I can't think of a single instance where they acted in any other way than professionally, and I can't think of one instance where actually anybody on our board has failed to abstain or recuse from voting, and I guess it begs the question, like, and I'm struggling with this. Why did the rulings come out the way they did on the 2 individuals that just resigned? To me, it's a slippery slope. If our interpretation is that tightly constructed, then who's next? Who's next? Whose name is going to be thrown? I mean, probably only those of us that are retired and don't have any vested interest would be the only safe ones. And I think, we have 2 conflicting interests here. Certainly, we want to convince the public that our ethics are beyond question. But there's also another big component. There are people that voted to put these individuals in office because they had trust in them. So every time we put somebody in a corner and tell them that they should resign because of an ethical ruling, we're not just passing judgment on that person or allowing judgment to be passed. We're also disenfranchising a whole group, thousands of voters that put those people in office. So if it's, like you said, Steve, if it's the narrative of our ethics law that has caused the last 2 people to resign, then we should darn well be taking a look at the narrative. Because, and I don't know, I would certainly invite the rest of the legislators to weigh in. I'd like to know of a single instance in which those individuals have been anything but professional.
Curran. Ms. Curran, you had your hand up, did you?
No, I just did this.
Mr. Forsythe does though. Go ahead, Dave.
Thank you. I find this an interesting conversation, to tell you the truth. I was here for the original Democratic push ethics board by your now congressional candidate that pushed to have a St. Lawrence County Board of Ethics. And it was contentious. Many meetings, many drafts, many discussions went into the whole development of the Board of Ethics. Now, at the first ruling in probably 12 years that they've come up and made something that disenfranchises some, we want to reevaluate it. and I just find it almost hilarious. There was very much time put into this. Circumstances change as time goes on, employments change as time goes on. I wasn't a firm believer at the original Board of Ethics, but it's worked up till now. And now, because it doesn't fit a perspective, we want to discuss changing it. I just can't believe we're even discussing it, but that's just my comment. So thank you.
Before I recognize Mr. Arquette and Mrs. Haggard, is there anybody that hasn't spoke to this that wants to speak? Mr. Akers.
Yeah, I was going to mention that I thought the birth of this was with Tedrick Cobb, but Dave, you were there. I was not. So, Mr. Burke, I'm sad to see all three of these people go. Actually, although Margaret is much better looking than Dave, it seems like a more pleasant personality. But certainly Nancy and Henry were valuable members, and I understand that what you have to say. I will say, and that particularly, we'll just use Henry as an example. Henry represented 9 towns. So particularly in the issue with the sales tax, when you had the Association of Towns come out with a resolution stating that they wanted to keep the sales tax the same. Henry never, of course, we never took any votes, but he never sidestepped the discussion or excused himself. So not that that would affect it or whatever, but when you come down to it, 9 towns is a lot. There'd be a lot of pressure on Mr. Leader to acquiesce to their demands to keep sales tax the same. So, you know, I'm not familiar with the ethics law itself, but, you know, they want you to list all your relatives and your financial obligations and stuff. I think there's plenty of good people out there, and sometimes they need to get off their duff and become involved. So, yeah, I'm sad to see all three of them step down. And, you know, I'm not aware of the process of how it came about or anything. It kind of was a surprise to me. Thank you.
Anyone else before Mr. Arquette or Ms. Haggard? Rita.
So
Kerr.
I don't know exactly what happened in those cases. It seems like at least one of their circumstances changed after they were elected and cleared the initial screen. Steve will tell you, I've had people offer me a couple of board positions that I've had to ask first, couldn't I? And just at the outset, Steve said to me, that would be, a conflict. So you just decline it and don't do it. So I think you have to think before you take jobs too, what it's going to do to you.
Anyone else? Mr. Arquette.
Thank you, Joe. And again, like I said, my intention was not to be argumentative, nor was my intention to go back into the history of how we got here. But hearing the comments of one legislator to be appalled that we're suggesting that as we move forward, we may need to take a look at this, when I'm pretty certain the gentleman just lobbied our own government to open up a DMV office that would have a direct effect on his own business. And then he's appalled that we brought this up for conversation with the intent to not be argumentative, with the intent to move forward. And he's appalled by this. I'm appalled by him. Thank you.
Ms. Haggard.
Speaking to the previous Democrats who put this into law, it's great. But the great thing about laws is they can all be amended or changed and looked at. And I think it's been several years, if my memory serves me well. Ms. Cobb was on the board several years ago, so I'm assuming that that's when it was done, if that's correct. And I'm wondering if this comes about, and I'm not sure if this is for Mr. Button, but are constituents complaining about people's positions, or how is it that all of a sudden we're at this, are people, well, I know what the case was in my case. I asked for an opinion prior to being appointed to this position, but I'm wondering how we're getting there and if we're now in a position where other board members say, well, I think this guy's got a problem or this gal's got a problem, and I'd like the ethics board to look at it. Thank you.
Thank you. Anybody else?
Would you like me to answer her question?
Mr. Forsyth?
Oh, someone wants to answer the question? I heard someone.
Yes, please.
Mrs. Haggard, I do apologize. Under the law, advisory opinions are technically confidential. As your counsel, it is something that I can speak to you in executive session about, but it is not something that I can share publicly. And I don't mind having that conversation privately, but it is not something that I can share openly at this point.
Oh, thank you, Mr. Button. Thank you, Mr. Chair.
Yeah. Mr. Forsyth, then Mr. Burke.
I'll make it short. I just want to stress to Mr. Arquette, I'm surprised you're so easily appalled.
Ditto.
Really, the DMV offices have no clients who I serve the private sector, Tony. So I deal with clients every day, walking in and off the street, and it's their convenience that I hear. Same as many of us hear from taxpayers, constituents. My clients are very disturbed. So if the DMV shut down tomorrow, my business will not change. So thank you.
Mr. Burke.
Without looking at the origin of how this all came about, I'm still, and I'd love to have somebody explain it if they could, or if the Board of Ethics could explain it, still in a quandary as to why both Henry and Nancy would have to resign by virtue of ethics. And I hear what you say, Dave, but not Dave, Steve, I heard what you said about the confidential nature of this, but there is also, I think we have to be transparent with the public, especially the public that put those two individuals in office. I mean, I think they deserve an explanation. How could this be? And again, you know, from my perspective, if it's a problem in the writing of the law, then we need to fix it. And if it's not a problem, I'd love an explanation as to how this could happen to two people who I thought were doing a very good job. Three people actually, but two recent ones that were doing a very good job. Anyways, I'll leave it at that.
Mr. Arquette, you already had two shots at this. I'll give you a sentence or two and that's it.
And that's fine, Mr. Chairman. And I'm not the last word guy, but I'm not going to have somebody say that it does not advantage his business as he spoke and leave it at that. I just can't do it. Thank you.
My suggestion, after Mr. Reagan speaks, you will hear. Go ahead, Jeff.
Thank you, Mr. Chair. It seems very unfortunate to me that the idea that someone is representing several towns poses some sort of ethical quandary when, by the very nature of these positions, legislators are expected to represent the communities from which they are elected and the communities in their district. This board sprang from the original Board of Supervisors, and the idea that a legislator would have some ethical problem because he is working on behalf of various towns. I find it hard to understand, and wonder whether or not, I think it should be the voters that make decisions on whether or not the people they elect are doing their will, rather than this committee. It seems an awful shame to me to lose very bright, talented people who brought a lot to this board, and who were working very hard on behalf of the people who elected them. And the original concept of the ethics board was to prevent unethical behavior and help screen out and identify real problems. And it seems that it's being abused, and it's not in the interest of the people of St. Lawrence County.
Mr. Akers, this will be your second time.
Thank you. And it'll be hopefully my final. The example that I gave Mr. Reagan was hypothetical. It is clear that Henry did represent 9 towns. So just say, for example, that at $250 an hour, meeting with the 9 towns per month or whatever, it's a financial interest. I don't know what the Board of Ethics, what their ruling was, but certainly there would be a financial connection. And I don't know why Henry Leader submitted the request for an ethics ruling. I don't know anything about it. I'm sad that we're losing Henry. I'm sad that we're losing Nancy, and I'm glad that we have Margaret. So, okay. So I think we beat this to death, and I think we just each parties it's one Republican is been by the Board of Ethics has been ruled out, and one Democrat has ruled out. It'll be up to the respective parties to make other choices. So, it seems like a big hullabaloo. That's a great discussion, but I think we've beat this to death.
Anybody that hasn't spoken? Okay, everybody else has had at least 2 shots at this, and 2 shots are the limit, folks. You're aware of that. I'd like to just say that nobody in this room or out in this venue, out in your homes where you're coming from, were a part of the deliberations that the ethics board had. So you don't know, I don't know, we don't know what they base their determination on. So to be critical of them, I think, and not that there was a lot of criticism of them, they're doing their job. Yes, there were people that were affected that we liked, we worked with, they were our friends, our cohorts here, and they were doing their job as legislators. I don't think that you will get anybody in here that would disagree with that. But you don't know what they base their decisions on. If you want to know, go to those people and ask them to see what the decision said. I haven't seen it. Nobody has shown it to me. All I've gotten are letters of resignation. I have not seen what they base their decision on. If you want to know, go ask them. We're going to move around now to new business. Is there any new business? Ms. Curran.
Hi. So on June 14th, I'm going to say it today because it's before our next meeting. On June 14th, we have a USDA surplus food allocation that's going to be in Messina from 9 a.m. to 12 p.m. at the high school. If there's anybody from towns that have specific needs, we're going to have 4,500 gallons of milk, 1,500 dairy boxes, and 1,500 vegetable boxes. So if you think that your town would be interested in any of that, please let me know, and we can get some to some of the other towns instead of it just going all to Messina. I want to make sure it all goes to people who will use it.
Rita, would you give us that date again?
June 14th, it's a Sunday.
And
And
where will they,
the Messina
where would
High
they go and
School,
who would they contact?
contact me.
Okay,
And it's Messina High School. It'll be in the parking lot. But if people are going to come from towns and villages, we could certainly just give them some in a truck to take back.
okay, thank you very much. Thank you. Anyone else? Ms. Haggard?
Could I ask Ms. Curran a question?
I
Sure.
beg your pardon?
Okay, Mr. Chairman, I'd like to ask Ms. Curran a question.
Please go ahead.
Thank you. Other than people coming to get the food to distribute in our own towns and villages, is it possible for us to direct constituents to that food pickup?
Yeah, it's going to be drive-through, Mrs. Haggard. You're going to go right through the circle at the high school and then alongside of the bleachers and out. And people will just pull up and open their trunk, and we'll give them a couple of gallons of milk, a dairy box, and a vegetable box, unless they tell us it's one of them.
Is it being advertised anywhere?
Advertising goes up, I believe, tomorrow. And just so you guys know, the dairy people, the kids that talk tonight and the rest of their dairy entourage are going to be there to work the dairy parts of it. If anybody wants to come and help out, you're more than welcome to.
Great, thank you.
Anyone else? Any questions for Rita? Seeing none, any other new business? Moving backwards, we'll have committee reports. Are there any committee reports? Ms. Curran?
We finally had the EMS Advisory Board via Zoom, and we talked a lot about how we're going to review all the bylaws and get, I guess we have a couple more board members than what we originally thought we could have by the bylaws. So we're going to work on fixing that. And then we're doing kind of a summary of all of the different problems we've had during this COVID pandemic, and trying to figure out what ways we can work with different agencies. And then I probably will bring you something to the board to sort of give you a more timeline sort of story about what went on.
Okay, thank you. Anyone else? Seeing none, we have need for an executive session. And I would entertain a motion to go into an executive session by Ms. Curran, seconded by Mr. Fay, Mr. Denisha. All in favor?
Aye.
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 Opposed? Carried. We'll wait for the electronics to clear and we will go to executive session.